Hello, everyone. We're just waiting for some others to join as they're coming into the waiting room. So we'll take just a minute to do that. Well, good afternoon, everybody. I think we're going to go ahead and get started. I know we have some others that are still joining us and they won't miss too much. So I want to welcome everybody to the Ensuring Equitable Access to Early Childhood Programs webinar that we're presenting today with one of our national partners, NHSA and Kent Mitchell. Next slide. So today, just to kind of let you know a little bit about the meeting overview, it is being recorded and slides will be emailed to you after the meeting. If you have questions, I would prefer that you would put them in the chat rather than raising your hand, just because it's trying to do the tracking of the questions. If you need any kind of technical support, please connect with tech support in the chat. This is a pretty large group, so we do ask that you would mute your microphones and of course stay off video during the presentations. There will not be breakouts for this one, so just feel free to listen, and closed captioning is available should you need that as well, that resource as well. And of course, we really appreciate your joining us today. Next slide. So Voices for Healthy Kids several years ago decided to create a model called Innovation, Equity, and Exploration, which is Ieee for short. It was really intended to convene and collaborate with other partners around different topic areas. The purpose was to explore these cross-cutting and trending topics related to our policy issues that we were working on, to engage with other individuals and organizations who were going to help provide key perspectives and expertise in communities that are affected by these related public policy topics, and enhance the knowledge and interest of organizations that have similar goals. Next slide. In terms of vocabulary, you know, all of our organizations have our own language. So I did want to just share with you a little bit about what we mean when we say innovation, equity, and exploration. Innovation, as you can see here, is really to identify and translate new ideas and these topics into potential policy opportunities and solutions. Equity, which is throughout all of the work that Voices for Healthy Kids does, provides diverse membership representation, diverse expertise, and diverse organizations to learn from each other about current and potential policy changes that affect communities in real time. And of course, exploration is learning and listening from a variety of these experts in perspectives, learning from research to demonstrate or support key questions and develop these potential recommendations or solutions. Next slide. So again, we're very, very pleased that National Head Start Association, or NHSA, who led this Ieee work group, did such great work that we really wanted to feature it for all of you. The goal of the Ieee was to identify barriers to access Head Start and early Head Start programs for eligible families, included those rooted in discrimination, which were affected also quite often by access to these programs. I'm very happy to welcome Kent Mitchell, the Senior Director of State Affairs, who led this work with a great work group membership. And just some background for Kent, as he works to advance related state and federal policy, expanding access to EHS and HS, began a career on Capitol Hill as an aide to Senator Edward M. Kennedy. He led strategy work for Pew Charitable Trust and other nonprofits. He has a passion for infant and toddler work. And of course, during the pandemic, he became a huge Premier League soccer fan, as I'm sure we all kind of have new things that we learned during the pandemic when we were isolated. So without further ado, Kent, we're looking forward to your presentation. Thank you.
Great, thank you so much. Well, I'll go ahead and pull up my slides here in a second, but yeah, just honored to be here again with Voices for Healthy Kids. And it's been a tremendous partnership. The partnership with Voices has forced us to really think much more deeply about equity. Head Start is an equity-driven community, but even then, when we were doing this work on barriers to access in particular, it really forced us to engage with some very difficult questions and engage our field in those. So just really thankful, for the opportunity to dive deeply with a group like Voices and folks like yourself. So today, I look forward to sharing some of our findings, and hopefully you'll find this will trigger some good thoughts for you too. Again, this project was really about identifying eligibility barriers, access barriers for families, especially those that might be rooted in current or historical discrimination and policies that follow as such. Head Start is a very large program all across the country in all 50 states, territories, prenatal to 5. So those barriers are going to vary, but we did find quite a few that bubbled to the top and were quite common for folks. So again, just want to give thanks to Voices for Healthy Kids and the American Heart Association. NHSA's vision is really to be that untiring voice that will not be quiet until every vulnerable child is served by the Head Start model of support. And for those who don't know, the Head Start model is not just about the child, it's about the family, about the community, and the comprehensive services that kids need when they're young to thrive, health, family support, etc. We do a lot of advocacy. That's what I spend most of my time doing, state and federal advocacy, and uniting our community of supporters. That kind of speaks to our mission, right, which is to really coalesce, inspire, and support the Head Start field as a leader in early childhood development and education. And we are at nhsa.org. If you want to check us out, we have a lot of great resources and tools there. I want to start this presentation, just recognizing what an unprecedented time that we're in. Every day on the news, there's something new, unique, unprecedented, whether that's climate change, whether that's what's going on with our kids or community violence or what have you. So the things most relevant here, I think, to mention are the lack of early care and education opportunities for kids and for families right now, particularly for women who want to re-enter the labor market or enter it anew or pursue education or job training. There simply isn't enough availability of affordable and high quality early care and education. Our field is also being roiled by the Great Resignation, burnout from COVID-19, rampant turnover, part of it due to low compensation and that coming home to roost finally, thankfully. But there are many other dynamics there in the early childhood workforce, including their wellness, which has been very much at risk during the pandemic. So huge turnover, lots of challenges with retention, and early childhood programs are competing with Target. They're competing with other employers who are not in the aligned fields, right? And then finally, always centering it back on the child, on the children. We know that the impacts of the pandemic are going to persist for years, if not generations, unless we actually invest in early intervention, in education at all levels of our nation, and really view the mental health issues of our children, their developmental needs, as a top and urgent priority. We were definitely disappointed to see a reconciliation bill about to pass in Congress that does not include childcare, does not include Head Start. And we're going to continue to fight for that, for our workforce and for our children and our families. I will make note, right, during the pandemic, Congress and states have been doing quite a bit, actually, to address some of the structural inequality. I think most notably of the child tax credit that passed. That relief, as you all know has expired and is not included in any ongoing legislation. And of course, inflation. Inflation is falling hardest on the poorest families. Like many things in our society, the distribution of pain and burden is not equal. And so we're seeing that with inflation as well. Children will suffer, families will suffer. So we need relief from that too. So all that said, right, accessible, high quality early childhood education, especially the kind provided by Head Start, early Head Start, is more necessary than ever because it supports children, it supports families, and all of these sectors, right, whether it's preschool or home visiting or special education or libraries, all have this mission, right, of thriving children and families. I want to give great credit to the Build Initiative for this graphic, which I love and I use often because it shows, really centers children and families, and it shows what they need to thrive and all the institutions that can support that. I'm sure you identify with or lead or support institutions in this list, and I hope you see yourself in this. So just a little bit of background, what is Early Head Start right now? I'll just give you more of a sense of scale as much as anything. Right now, there's about 850,000 slots nationwide. Those little blue dots represent that. You'll see the number of classrooms, about 17,500 classrooms. We don't make a huge distinction right between the prenatal to 5 services, but technically Early Head Start is prenatal to 3, and then Head Start is preschool ages 3 and 4, just so you see the delineation there. There is American Indian, Alaska Native Head Start specific for that population. There's also a specific Head Start program, Migrant and Seasonal Head Start. Both of those are making credible contributions to child and family development and our understanding of how to serve unique populations in our country. This is our kind of graphic, a lot of data here. We kind of break down the impacts every year, the outputs, I guess, around children and families and community. I'll focus a little bit more on the children here and note that access to healthcare, access to health screenings, immunizations, dental care, EPSDT screenings, that's all part of Head Start's model, especially Early Head Start, where they're even more, of course, children are younger, so they're getting more of these check-ins and screenings, et cetera. That's why we're such aligned partners, I think, with you all and with Voices for Healthy Kids, because of the focus on health, child development in the early years. So that's a little bit about what Early Head Start and Head Start does. And there's always new research, right, emerging about health-related research, in specific about Head Start, Early Head Start. This article was just from August 3rd, last week, about how Head Start programs provide effective intervention in addressing childhood obesity. We actually did a whole series on health with Voices, with coalition partners. And so if you're at all interested in that, put your name in the chat. We probably have the recording or slides from that, which really speak to the health outcomes, health impacts of participation in Head Start and Early Head Start. I also want to make sure everyone, understands NHSA also believes, fully embraces childcare. Childcare is essential. Childcare that doesn't necessarily have the performance standards of Head Start or the comprehensive services, but it offers incredible value and support to working families in particular, offers a safe place for children, a lot of development, growth, learning. 860,000 children are served by CCDF, 87% of families receiving child care subsidy cited employment, education, or training as the need for receiving care. Head Starts, Early Head Starts do a ton of partnership with child care. Many of them, about a third, access child care subsidy themselves. They take in child care funding. And so child care is a huge part of our solution, our landscape. I want to particularly point out home-based child care and how essential it is because it's so equitable, it's so in the community, it's so culturally responsive. We strive for that, of course, in Head Start, and I think family child care has so much to add to that landscape. And of course, pre-K. I'm sure many of you worked on pre-K issues or pre-K campaigns. Pre-K is an essential component of school readiness. It does primarily focus on 4-year-old children, whereas Head Start and child care, right, are going to be focused prenatal to 5. But an essential contribution, to our children's development and to family support as well. So this is where we kind of turn to the issue of barriers, though, right? And start thinking about, what if access were denied? What if Head Start on the left there? What if childcare in the middle? What if pre-K on the right-hand side there? What if all those children never found their way to these programs? What are the reasons they may not find their way there? And what impact would that have on them, on their families, and on our country as a whole? And I like to bring it down one level further. We do a lot of storytelling at NHSA and share this story of Galena. So Galena was an Early Head Start parent. She signed up when she was pregnant with her first daughter. So in Early Head Start, you can sign up prenatally to receive services and then have a slot reserved for your child. Galena is autistic herself. and she's a mother of two. She worried. She had a lot of worry when she was starting to raise her children that someone would try to take her children away. And she wanted someone to partner with her, but also witness and support her parenting. And so she was driven by that need, and she connected with Early Head Start. And I'll read her quote here because her words are incredibly powerful. She writes, "I've been able to leave the children at school and complete medical treatments I needed. I've been encouraged to broaden the activities our little family does together. My husband and I are spending more time together. I'm also starting a business that may someday pull our little family out of poverty." All of that was helped along by Early Head Start. So Galena faced real barriers. She managed to overcome them, whether by grit or luck. But we want for every family like Galena who needs Early Head Start or Head Start to access it. And we don't want barriers, right, getting in the way of someone like this and this family finding their way to our program or to other high quality settings and placements. So today's goal with that as preface is to really get into some of our findings about the top barriers to equitable access to Head Start and Early Head Start, and to discuss those policy changes, which I'm sure you'll be interested in, that we've recommended to Voices they explore and look into, and we will cover those today as well. Okay, so we're going to dig right in to the barriers. Not going to go through all our methodology here. More so, I want you to notice and attend to that it was very comprehensive. We built our work on layers and layers of research that had been done by experts and others in the past. We did deep dives into 4 states, thanks to Voices' interest in that. So 3 southern states and New Mexico. We did a major survey of our community with 2,400 responses, which was critical. You'll see a lot of that in here. So a lot of work to hear from people and learn from them, and not just read literature, right? So we're going to go over each of these over in the call, but this is kind of our summary slide. And so I'll just outline the top 7 barriers. These were really common across all communities and respondents, et cetera. So number 1 was the lack of transportation and outdated geolocation of programs of center-based care. Many Head Start programs have had to, and I'll go into this in more detail, I guess, they have not been funded to provide transportation. And as you can imagine, that's an equity issue. If the family doesn't have transportation, isn't in a place where there is any public transit or can't afford it. Huge issue, and the location of centers, of course, impacts equitable access. The second is a very important bucket of things, which we call family socioeconomic issues. And that, again, our population is children and families living in poverty. So that can mean housing instability, frequent moves, lack of cell phone. There's a whole range of issues, of course, encompassed in that, which impact access and which programs can address. They can legitimately address these things, especially in partnership with others. The low income eligibility limits, we'll talk a fair amount about. Head Start has low income limits, and those have had some discriminatory impact we're going to cover. There's the lack of overall supply, especially of early Head Start. There are simply not enough infant and toddler slots to meet the overwhelming demand. Many programs we talk to say we have a waiting list of 400 to 500 families, and that's very common for early Head Start. Inadequate hours of service. Many Head Start families want longer hours, more than the government requires and the performance standards for Head Start. They want a full day. They want the 8 to 10 hours, right? That is not mandated by the law. It's encouraged. So that's something our community continues to make progress on and drive toward. The workforce crisis, we're going to talk a lot about that when we talk about solutions to this. There's just a huge issue with turnover and retention, but also for this audience, a difficulty finding and paying diverse staff, especially linguistically diverse staff, and folks who can meet those cultural competence standards, et cetera. The literature is very clear. Race matching, ethnicity matching is actually very important for families and for children in terms of accessibility of programs and retention in programs. So we'll touch on that too. And then finally, just a lack of awareness. Families are overwhelmed. They're busy. They may not even be aware that there's high quality tuition-free Head Start, early Head Start in their community. And they may have a bias for school-based services, not recognizing the quality of Head Start that's been studied for 57 years. So we're going to dig deeper into each of these and make sure you have a good sense of what our community especially said about them. So I'm going to focus a lot on the right-hand side, which is more of the quotes from our community. So with respect to geolocation and transportation, a few choice quotes from our community: demographics changing drastically in the past 10 years. No one in our geographical area is income eligible any longer. So obviously for a brick and mortar place like a center, early childhood center, they have to figure out how to relocate, how to best serve families. We all know that neighborhoods and communities can change economically overnight, almost. And so they have to always continue to look at and plan for changes in who they serve, where they serve them. Parents that use public transportation spend on average 3 to 4 hours on the bus. So again, there's just inadequate investment in public transit in many places in America, which makes this issue of providing transportation even more critical. And another quote that was really important: some areas now that universal pre-K is being offered, families choose to go there if a transportation is offered. So schools, of course, are more likely to have the infrastructure and the funding to provide a bus and that kind of transportation. That may lead a family to not go to Head Start or not go to childcare, to disenroll even because of the convenience, of course, and the utility of having transportation, and we understand that. The second is this mix of socioeconomic issues. I think some of the power of these quotes here are delineating what some of those are. This first quote is really good: the availability of community resources like housing, mental health services, transportation varies greatly across the region we serve. A lot of folks focused on housing and housing instability, housing policies. They noted housing policies segregate and isolate. There are policies for bail and sentencing that lock persons out of employment, so really inhibiting family economic mobility and security. And the last person said, don't forget about the parents, right? I feel like the barriers are more providing resources to get parents involved in building up their skills. So really centering the solution that person there on. We have to engage our parents. We have to know what they need, know what they want, and provide it to them. The third is the low income eligibility. Again, just for this broader conversation, again, I will note, we believe and know Head Start eligibility needs modernization. It's not been updated for over a decade, and it doesn't reflect where families are and what they need and the population that needs Head Start, early Head Start. So these are some of the typical quotes, right? If a family's in a community with a high minimum wage, and most jobs are offering $15 right an hour now or more. This person said we have 106 applications, only 52 are income eligible. So think of that program director, right, who's sitting there and going, oh my gosh, this family really needs this, but half of them can't even qualify because our artificially low federally set guidelines. So we're continuing to work on that. Our families making minimum wage do not qualify, but with the prices of gas, food, clothes, utilities, how can they afford daycare? The answer is they can't, right? So if many families who don't get into Head Start, early Head Start, they don't make enough to afford childcare. They may right now because subsidies are higher and states are providing more relief, thankfully. But reconciliation, the Build Back Better didn't pass. We don't have universal childcare in America. So a lot of families who don't get in because of eligibility may not end up having a place for their child. And this is a really big one. This is more of a detail one, but for children who are enrolled in early Head Start before the age of 3, before they transition to preschool Head Start, they have to go through that eligibility process again. The tragic thing is that a lot of families during that time get the support they need. They make modest advancements in their economic well-being, their education, etc. Because they do that, they no longer qualify for Head Start. And that makes no sense because children on a positive trajectory need to stay on that trajectory, and those families likely cannot afford high quality childcare. I touched on this one again. This one's really near and dear to me. You know, one of my passions from the first slide is infants and toddlers. Early Head Start is just overwhelmed with need as more families return to these settings. We need more hours in classrooms to provide what families need. And sometimes there's public school resistance to partnership, right? Sometimes that those children in Head Start, early Head Start, don't belong in a school, they belong in Head Start, or there's just no understanding of how to partner in local communities. I mentioned the inadequate hours of service. I think these quotes are useful. The only barriers I have witnessed is for the working parent. The school hours are not early enough. 7:30 a.m. is when our school opens the doors. And that they're referring to another school, right? So Head Start may not open until 9 a.m. So real challenge there. Differing hours of the program with those hours worked. And state programs, they mean state pre-K, stay full due to continuity of care and longer service hours. Traditional Head Start works for low-income families who do not work full-time jobs. We have historically low unemployment. Head Start has a very diverse family base, and more hours of service would be very helpful. There's a range of workforce issues. Some are very obvious, right? Higher and competitive wages. I could go on for an entire, hour, 2 hours about our workforce and the inadequacies in how we compensate those folks, especially for their level of knowledge and the impact they have on kids and families. Others say we just don't have enough staff. We need more staff to offer the extended day in particular. If you're going to move from a 3.5 hour Head Start day to 6 hours or 10 hours, or you're going to move from 6 hours to 8 or 9 hours, you need additional staffing. You need that kind of coverage. Another person said we should have more bilingual staff to ensure supports. We have some, but not at each location. And another really choice quote, we are unable to pay the necessary wages to have bilingual people in management positions. And we know we're only going to drive equity when we have diverse leadership at all levels. That includes management. Many programs are saying we cannot pay or afford those folks. The last one, again, is this lack of awareness and perceptions about Head Start. There's some lack of awareness, right, of the family service components to the program. Head Start isn't just a place where you drop off your kid. It is a place where you're involved, you're engaged, you get home visits, you get connections to a medical home, your kid gets vision dental screenings, all that stuff wraps around the family. And so there's certainly a lack of awareness that that's part of the package. We mentioned some of the issues around pre-K competition with transportation and longer hours. And there is bias, there is stigma, especially with this audience. I want to make that clear. There is bias and stigma against any income eligible program in America, whether that's TANF, SNAP, Head Start. And this person said, it's, some people think it's for other children who, quote, need it. This is not an uncommon refrain. The issues of bias and stigma are very much alive in early childhood, just like they are in the rest of our country. Okay, so here's where we're going to talk a little bit about some of the differential impacts. This was a particularly important part, right, of this study because we wanted to unearth some of this, given the mandate from Voices and the opportunity to do that. The first thing I'd say is that when we asked, our field has a really pretty strong intersectional analysis. I mean, this is a community that lives and works with families living in poverty. Head Start's been around 57 years. Our staff is very diverse. Our children are very diverse. So they are not shy about these issues. I think they bring a lot of acumen to them. Saw that in the results here. So a few good quotes. Yes, the educational hour requirement, the work hours requirement, extreme low income requirements exclude a lot of children who may benefit from the program. That quote is clearly also referring to child care, not just Head Start, but really saying we kind of put this stuff out of reach unnecessarily, right, for children, especially children of color. I think the way that Head Start is regulated versus the way public schools are regulated shows institutional racism against the Head Start program. Strong sentiment in our field that some of the more punitive monitoring and accountability aspects of Head Start are related to bias, are related to discrimination, and they can inhibit access, they can inhibit partnership. And this one's really important, right? Low wages in Head Start and in local economies lead to high rates of income eligible, but not enough funding. So basically they're saying our economy, right, is structured to not provide folks the wages they need, but also the support programs like Head Start then are not funded to support those families. So kind of a double whammy that families face. There was a really sharp analysis of the racial divide in southern deep dive states. Again, we did deep dive work in Louisiana, Mississippi, and Alabama. We also did New Mexico. And I'll share, like, the deep dive findings were very different from the three more southern states and New Mexico in particular. And I'll read one of the quotes here. Head Start programs have the stigma in some ethnic communities, especially in the South, that only the poor and the Black attend there. So even if you are poor and white, you do not register to attend because Head Start is seen as the low of the low in the community. Also, more resources are available to poor Caucasians to keep them out of Head Start to perpetuate the stigma. The only way white families attend is when they are in a densely populated community of Caucasians, and there's a program nearby with very few African Americans. Hispanics are underrepresented for fear of government reprisal. So obviously a ton to unpack. We could spend a whole hour unpacking the dynamics, the structural racism, historical racism at play here. But to suffice it to say that Head Start is impacted just like any other institution that works nationwide by these dynamics. I mentioned before, housing discrimination is referenced consistently in our survey responses and in our work. And, there's some really deep analysis folks provided, a lot of reference to the historical longstanding nature of this kind of thing. The effects of redlining and housing practices are still obvious. Life expectancy is a 40-year difference from one neighborhood to the next, just across a river. Another quote, we experienced the results of 1930s redlining still, and vulnerable communities that experience socioeconomic, institutional health, and racial inequalities. That package, when we said the second thing is kind of that mix of family socioeconomic factors, that's housing. That's housing, it's discrimination in housing, and it feeds a lot of inequality in our nation. We asked the question, who are the top underserved races, ethnicities, populations by your programs? And was relatively surprised. I actually asked a lot, I was surprised. I asked a lot of our community later and they said, well, we weren't surprised, but Asian was the #1 response across both Head Start leadership and Head Start frontline staff. So frontline staff are going to be teachers, family service workers, et cetera. So 21%, and 23%, so basically 1 in 5 respondents said, hey, we have a challenge. We have a problem reaching and serving Asian communities. There were many types of communities mentioned. Burmese comes to mind, right, as one. There were many communities mentioned within that Asian category, and noteworthy that this finding came out of here. American Indian, Alaska Native, 16%, 19%. Various reasons for that, but certainly cultural issues, access issues. And then Hispanic, the same percentages, 16%, 19%. One good quote, Spanish-speaking families do not apply due to the fact of the language barrier and finding qualified staff. I will note over about 40% of Head Start children are Hispanic or Latinx, or however you qualify that. Office of Head Start uses Hispanic. So 40%, 4 in 10 are Hispanic, but our community still believes they can be doing more and reducing those barriers to access. We specifically asked questions about income limits, and I think a lot of this would apply to childcare policy too, not necessarily pre-K as much. But when you look at income limits, right, 7 out of 10, 70% said higher income limits would yield greater diversity. And they were, when you look at that, you go, okay, and some of our allies go, okay, you say you want higher eligibility, but children of color are disproportionately represented among the poor. Well, our community was very specific about some of the types of diversity that they are not seeing, and because of our low income eligibility. They mentioned 2 earner families, economically mobile families, Hispanic families, families in factories and plants like meat packing, where wages might be higher, or folks work multiple jobs, small business owners, children of Head Start staff. And they also referenced, right, economically mobile Black, African-American families, right, and others. So really strong sense from our community that raising or modernizing our eligibility for Head Start would have a very positive impact on diversity and strength of programs. And I will check the chat, make sure I'm not, I will have to get back to that question. Policy implications. Okay, so let's go into that. Actually, let me see, Nadal, I'm gonna check that chat and make sure if I can answer that question.
There is a question that says, do you have any data as to the same sex or gender diverse households that are in the program?
Great question. I do not. I have not seen that information. We did ask a question on this survey because our focus was on barriers to access, which asked, how important is it for a program to be welcoming? And I mean, the responses are off the chart for families in terms of they extremely value a welcoming and belonging program. We specifically asked about barriers to access for LGBTQI individuals, and it did not receive a high survey response in terms of, at least our folks who responded to the survey said they did not believe that their programs were viewed as unwelcoming, right, or not attentive or open to or inclusive in that way. I know that doesn't exactly get at your question. I'm quite confident that the Office of Head Start does not collect this information, but it would be incredibly valuable for NHSA to know that. And I'll definitely take that back to the team as a point of exploration. Okay, I think that was the chat there. So is it okay to go into policy implications, or did you want to pause on anything?
No, that's fine. And that's the only question that was in the chat so far.
Okay, cool. Well, I like to leave this section off with saying a change can happen. We had a really big change in Head Start that just happened in April, which was a huge change our community had been fighting for over 5 years. And you know how things go from idea to conversation to finally happening. And this was a big one. So basically now, if a family is on SNAP, and SNAP is one of our most widely used entitlement programs, those families, those children, if they're under age 5, are now automatically eligible for Head Start. They don't have to prove that they have a certain low income. They don't have to go through more paperwork. All they have to do is show their SNAP card, a notice of approval, or other documentation of food assistance, and their child qualifies. Now, that doesn't mean they automatically get a spot in Head Start or early Head Start, because there's still limitations on capacity, but it does mean if you're a SNAP family, you qualify for Head Start. It's going to bring a lot of alignment and partnership across local communities and states. Our associations and states are working very actively with their SNAP agencies to try to get the word out about this and coordinate data sharing, et cetera. We're really excited about the opportunity this is for families who can be supported by both SNAP and Head Start, early Head Start. I'll also just kind of go back to the acumen, going back, you guys are in the same mindset of like, we got to listen to the people who do the work. And the people who do the work, we ask them, what helps you? What helps you to attract and to serve and diverse families? And the top 3 responses were, again, super consistent across our leadership and our frontline staff. Encourage families to refer others, build authentic relationships with families, and run a quality program. I know we all are more policy people on the call, but I did want to point out a huge component of this is this kind of stuff. It's the implementation of the standards. It's actually caring about and engaging families authentically. And it's viewing parents as people with assets who can help build the awareness and strength of your program. Just going back to that practice piece too, and of course this implicates policy now a lot too, a lot of Head Start programs are focused on diversity, equity, inclusion. We had a number of questions asking them, how do they prioritize it? What do they do? And you'll see a few examples here. There's reams and pages of information on innovations and things folks are doing. And yeah, well, from partnerships to language to trainings to you name it. So I think like the rest of our country, we're catching up and grappling with this history and trying to figure out how to build more inclusive and justice-oriented programs. Okay, this is kind of the big policy slide, so I'll spend the last 5 minutes or so on this, and then we can see if you want to have any conversation or folks want to raise their hand and ask questions. So what are the state public policy solutions? The federal ones are generally pretty obvious, I guess. We work very, very much on that. I wanted to focus on states with you all. Number one is workforce. Doesn't matter if it's Head Start, pre-K, childcare, home visiting, doesn't matter. And we wouldn't expect any one bill or legislation to target, just one or the other in a state. I mean, the most important thing is that we give better compensation, career pathways, and recruit and retain, a diverse, qualified workforce that takes care of our youngest kids and our families. So anything you can do on the advocacy front, even to move that needle a little bit, would be tremendous. As far as benchmarks, the federal legislation that was on the verge of passing talked about a living wage, and it also talked about comparability with K-12 teachers. Both of those are benchmarks that are going to be difficult to reach, but if we're really focused on equity, we want educators at all levels to be paid fairly. And of course, we want folks to have a living wage. So just to give you a couple points of reference there. Decision-making, how do programs, how do states make decisions about where to direct resources and how to reach the most vulnerable kids? So a couple really important things here with recommended voices. One is, and there's a lot more behind these are just really high level bullets, and Voices has the full recommendations, but relational family outreach, engagement, and support. I mean, that can be as simple as doing a family needs assessment, right, in your community and knowing what families want, what need, what kind of hours, what kind of services, et cetera. And there's some really good work on neighborhood risk and how to incorporate a holistic understanding of the vulnerabilities of children and families into where you target resources and how you do outreach and all of that. The third is actually the services you provide. Those can reduce barriers to access tremendously. So quality improvement funding is called QIF. There is a statute for Head Start federally around QIF. And we think that kind of funding should be available across all state systems. That's very flexible funding that programs can use for things like workforce compensation, transportation, trauma-informed care, recruiting a diverse workforce, retaining that workforce, staff wellness. It's a catch-all bucket, but very equity-focused. And so definitely elevating that concept. Doesn't need to be called QIF in a state, but does your state have flexible funding, basically gap funding, right, to address barriers like that? The second, more family services and early childhood education. That's covered in Head Start, right? The Head Start model is family and child, whole family. That's not necessarily the case in a lot of early childhood education. There are pieces of that which we know are very impactful, like home visits, for example. Some childcare programs have incorporated home visits because they know how important they can be to strengthen engagement with families. There are pieces of the model or the whole model that other settings can adopt. And comprehensive services shouldn't just be in Head Start. They should be in other settings as well. Realistically, they're never going to be everywhere. They cost more, right? It's more complicated, it's higher staffing. But what are the things that your state, your community could benefit from? Transportation and siting, geolocation issues. I think it could be realistic to have standalone bills in state houses on that around school childcare partnerships, right? creative local funding opportunities? How do we get young children to high quality programs? There's no reason that's not a public interest issue. It certainly is. We would be mortified if children couldn't, find their way to a high quality school, and we should be similarly mortified, right, if they can't access high quality care and education just because they don't have a car, right? So I think things like that can be addressed in the state level. An entitlement to dual language services. There's no such thing to my knowledge in any state or any early childhood system. I could be wrong. Head Start has some very strong standards around linguistic competency, cultural competency, but it falls short of a full entitlement. Entitlement, like saying, hey, you have an entitlement, is not the same as actually having and executing an entitlement. But I do think our community can be working toward the day or the vision when children, regardless of their language, particularly if it's one of the more predominant languages in our nation, can expect to receive early childhood services in that language and or dual language, in a program. Fourth is expanding early Head Start, right? I put this on here for the obvious reason that we think that's one of the solutions. In particular, a lot of our state partners are excited about early Head Start childcare partnerships. Early Head Start can partner with childcare. It can do all kinds of things to expand access to high quality in community settings. So great opportunities there. And this other one, for your knowledge, like a federal Head Start grantee can say, hey, we did a community assessment. We need more infant and toddler. And they can go through what's called conversion. They can switch those slots from preschool slots to infant and toddler slots. But there are startup costs associated with that. You have to buy cribs. You have to make sure that the infant toddler room is now licensed. You have to do things. I think an easy win would be to have states provide conversion support. It's a very quick way to align with the natural incentives of many Head Start programs to convert, but they could benefit from small grants, little funding to support that along the way. And then what would you have? You'd have really high quality infant and toddler slots in a community, and those are essential. So those are really some of the top solutions. We're always thinking of new things and listening to our field, but those are some of the important ones we've articulated to voices, and I wanted to share with you today. So Nada, that concludes my presentation. I'm happy to answer questions or engage in any way.
Yeah, there's another question in the chat, Kent, that you might be able to address. Misty is asking, in your experience, are the state public policy solutions similar to tribal, city, county, or local policy solutions?
Wow, interesting. I have to dig deeper. Is there a place, is there an issue in particular you're thinking of with early childhood, Misty?
I'm actually the community advocacy advisor serving the Midwest for American Heart Association. So I was really interested as we kind of look to and explore assessing opportunities at the local level throughout the Midwest. We obviously lean in on appropriations to help support and lift up childcare, ECE, Head Start, early Head Start, particularly through appropriations. So I wasn't sure if this information sort of translated to the local level as well.
Yeah, so my general sense, and I'm not an expert in local or city or county policy, I've never worked at that level, but what I would say is that the issue of barriers to access is best understood, right, and dealt with at the local level, because while there's systemic issues, barriers in one part of Illinois, right, are going to be very different than barriers in another part of Illinois, right, rural or urban or what have you. So I think it would be very easy and comfortable to have that policy conversation at a tribal, city, county, or local level, and then figuring out what are the highest leverage, opportunities. So yeah, I think many of these things could and would work at that level. Some of these things right on this list are more expensive than others, but absolutely, I think the conversation is very relevant in almost any of these areas, and understanding that, of course, it's critical to continue to leverage and to advocate for more federal resources, in particular, for Head Start, early Head Start, childcare, and ultimately pre-K. to make the local, local solutions, local innovations work. But yeah, happy to discuss more. I mean, as you know, pre-K is very active as a city county issue. There are cities and counties that guarantee pre-K all across the country. And they do that even though their state doesn't guarantee it. So yeah, I think you have some very rich territory there to explore.
Thank you.
Right.
I did want to let you know, Kent, there are a couple of comments in appreciation of your presentation. There's another question. Is there anything states can do to support eligibility? Stephanie was struck by the comment that families who are supported by EHS and increase their family income can then end up becoming ineligible for Head Start.
Yeah, I mean, yes. So what states can do, I mean, there's a number of things. One is that, I mean, the federal restrictions are what they are, but what a state can do is potentially provide supplemental funding, and there are 14 states that do, to Head Start, early Head Start. That supplemental funding doesn't necessarily need to be as strictly tied to the eligibility limits of the federal funding. So there are opportunities to serve above income families through state supplemental funding. Moreover, I think it's most important right now, though, that state advocates and programs, everybody, be driving around the SNAP change that I talked about. SNAP can go up to, I think 185% of poverty is the floor, and then the ceiling can be 250, 300% in some states. Now, most, that diminishes, right, as you get higher. SNAP rolls are concentrated among, Head Start eligible folks, but there are many above families who would now be considered above income by the Head Start Head Start income standards, but are enrolled in SNAP, and they now qualify. So I think one of the most important thing is to make sure that this exchange of information and referrals, et cetera, is happening between SNAP and between Head Start programs. That can drive full enrollment, and that can also help families who would otherwise be over income enroll. So I actually think the SNAP piece is probably the most important thing right now.
Thanks so much. Does anybody have a last question? We have about 5 minutes. Well, it doesn't look like we do. We have a lot of appreciation for the presentation. Kent, as always, it's a pleasure to work with you and learn from you as well. So we appreciate this time. Again, we'll be sending out the slide deck and some information for you in follow-up of this webinar. Thank you so much for joining us today, and have a great day. Anthony,
absolutely.
I'll
just put my email in there if anyone wants to connect. Happy to connect, and we do consultation all the time, and happy to answer questions or connect you to your state Head Start association or make other connections there. So thank you so much. Thanks, Nada.
Perfect. Thank you. Thank you, everyone. Have a great rest of your day.
Okay. Bye-bye.